Mothers are dying in the United States. Why? Joining me now to explain this is Dr. Priya Agrawal, the Executive Director of Merck for Mothers. Why? What's going on?
Yeah, it's a really interesting question. One never expects that maternal mortality is an issue in the US. You expect it to be in Sierra Leone, Afghanistan, India, all countries where actually the numbers of women dying during pregnancy and childbirth are coming down. In the US, they've doubled in the last 2 decades, and the deaths are just the tip of the iceberg. We have 1 woman every 8 minutes in the US experiencing a near miss. That means she nearly dies during pregnancy and childbirth and is saved by basically luck. And that's affecting women of all backgrounds.
How come we don't know this, or it's not as public, or, you know, when you say maternal mortality, you never think the United States. You never think mothers dying in childbirth or close to it.
So part of it is that there's complacency, right? It's not an issue in the US, which is why when you say why, I can't exactly answer why. I know the 3 leading causes, 2 of which are exactly the same in sub-Saharan Africa and India, bleeding and high blood pressure. But we also have data issues. We don't have a reliable way in every state to count our maternal deaths. Unlike with a heart attack, where everyone knows exactly what to do, there's no code blue or a standard protocol for the obstetric emergencies.
But don't we have better healthcare here in general?
Well, it's interesting. We spend $111 billion on childbirth-related healthcare, but we have the worst outcomes. We rank 64th in the world when it comes to maternal mortality. And you said we're healthier. That's not true. So this year, 1 woman out of every 5 pregnant women will be obese. They'll be diabetic and they'll have high blood pressure. So we're dealing with a lot of issues. But actually, I want to go back to what you said, the silence, because actually that's one of the barriers, right? Why are we not talking about it? We all recognize that mothers are important. Well, first of all, when a woman dies, the voice is gone. It's extinguished. She's dead. She's left a newborn with no voice and a partner who's stunned into silence because they're grieving and looking after a newborn. The women that are experiencing the near miss, and this has been fascinating for us, they're part of a secret society that they don't even know they're a member of. Women will talk about, oh, I had a C-section or I had normal delivery. But when they actually experience a near miss, they blame themselves. They don't talk about it. Now, if they're not talking about it, they're not healing, but it's a double tragedy.
Well, what is it that needs to happen, or that you would like to see happen?
So first of all, I think everyone needs to know about it and have a conversation that matters. Speak to your state legislator, speak to your friends, inform women. Pregnancy is not a disease. There are things that women and their families can do to make themselves safer and healthier. But then I would say there are the 3 needs that we're already working on. So Merck for Mothers is a global initiative. It's our $500 million 10-year commitment to maternal health. In the US, we're working in 16 states, covering about 25% of the deliveries in the US. What are we doing? We're saying that in those 16 states, you have to count every maternal death, review them, and make sure you prevent future ones. You have to have standard protocols for the 3 emergencies. And in every hospital, we're instituting them. And the 3rd, we're delivering new models of care. So if you're juggling pregnancy and diabetes and obesity, what do? We're bringing community health workers in to help you link, and also the use of the cell phone. So it's about innovation, but also scaling up what works.
Are you finding that you're having a greater impact in the United States, or in developing countries that you go to hundreds and thousands of miles out to a rural village in, you know, northern Benin?
Right. Fascinating question. So we're in 30 other countries other than the US, and the challenges are slightly different. So awareness is very high of this issue, ex-US, right? So the government buy-in is much higher outside of the US. However, they don't have the resources. So in the US, what we found is when we got the professional associations to define those protocols, they've been nationally endorsed, and now the US government is scaling them up to another 10 states, because the US government can do that. But actually, US is slow to adopt innovation. So we're innovating much faster abroad.
And also, when you're abroad, in many of your countries abroad that have leapfrogged in technology, you can go straight to mobile innovation with no infrastructural obstacles.
I mean, they say there's more phones and toilets in India. People use phones. Community health workers, that's like, we've been using community health workers in sub-Saharan Africa and India for eons. I'm actually struggling to just get a scope of work defined for a community health worker and government buy-in in the US. Wow. So there's just very different challenges.
What is the one question a woman today should ask herself?
Getting pregnant? I would say a pregnant woman, the number one question she should ask is, am I informed? So knowledge is power for a pregnant woman, because there are things she can do to prevent complications happening, and there are things that she can do to recognize warning signs. So she should go to a healthcare provider and she should say, what are my risks and what can I do about them? I always say, be informed and inform. Start a conversation, use your voice.
And finally, what has been the best piece of advice you've ever received?
The best piece of advice, I think it would be from my mum. So my mum's my inspiration. It's probably why I'm in the field of maternal health. She said, so she loves books, and the only page that's missing from my dictionary is the page with the word impossible. And if you knew her, that must have been painful for her to tear it out. She said, nothing is impossible if you care, and there's multiple ways to skin a cat. So I'm going to keep going till no woman dies while giving life.
That's fantastic. Thank you so much, Dr.
Thank
Priya
you.
Agrawal.
It's
really a pleasure. Keep up the great work.
Thank you.